Hey everyone, welcome back to the channel. My name is Aryan Malik. I am currently a nursing student in my third year of education. Today we'll be continuing our discussion on fundamentals of nursing, and today I'll be giving you some important tips and tricks that will help you as you prepare for the NCLEX. Again, I'm still preparing for the NCLEX. I have not yet given the exam, so please take my advice with a grain of salt and please do not rely on it completely. So let's get into it. When we talk about contact precaution, let's first understand what should be monitored in terms of droplet precaution. So whenever it says droplet, so I want you to think of Spider-Man. So think of 3S at the start, which is sepsis, scarlet fever, streptococcal pharyngitis, and then 3P, parvovirus B19, pneumonia, pertussis, and I as in influenza, D as in diphtheria or also called pharyngeal, E as in epiglottis, anything related to epiglottis, R rubella, M mumps, then again M meningitis, and then again M mycoplasma or meningeal pneumonia, and AN adenovirus. There should be private room or a cohort meaning that if the clients who have the same diagnosis, they can be put in the same room, but remembered only the clients who have tested positive, not the ones who are yet to be tested or who have been tested but the results have not yet been disclosed. So, and mask should be there, should be on the face. Now another thing for skin infection is V chips. So V as in varicella zoster, C as in cutaneous diphtheria, H as in herpes simplex, I as in impetigo, P as in pediculosis, S as in scabies. So whenever you see these terms, you can determine that it's a skin infection and approach it accordingly. Now I want to dive in some key terms. So first let's look at air or pulmonary embolism. Its sign and symptoms are the patient exhibits chest pain, difficulty in breathing, tachycardia. They are pale or also called cyanotic, and there is a sense of impending doom. The nursing intervention is turn the patient to the left side and lower the head of the bed. During epidural puncture, the patient should be side lying. After lumbar puncture and also oil-based myelogram, the patient lies in flat supine, and it is to prevent headache and leaking of the cerebrospinal fluid. Patient with heat stroke, they should lie flat with legs elevated. During continuous bladder irrigation or CBI, the catheter is taped to thigh, so leg should be kept straight. No other positioning restrictions are applied. After cataract surgery, patient will sleep on unaffected side with a night shield for 1 to 4 weeks. After thyroidectomy, the patient should maintain low or semi-Fowler's because it supports head, neck, and shoulders. The infant with spina bifida, one should position them prone, meaning on abdomen, so that sac does not rupture. And after total replacement, one should not sleep on operated side. Don't flex hip more than 45 to 60 degrees, and you should maintain hip abduction by separating thighs with pillows. Patient who has experienced shock, it is recommended that they maintain bed rest with extremities elevated 20 degrees, knees straight, head slightly elevated, or also called in medical terms modified Trendelenburg. When a patient comes with head injury, elevate head of the bed 30 degrees to decrease the intracranial pressure. For lumbar puncture, after the procedure, the client should be placed in the supine position for 4 to 12 hours as prescribed. For Graves' disease or hyperthyroidism, accelerated physical and mental function, sensitivity to heat, and they also exhibit fine or soft hair. During thyroid storm, it is increased temperature, pulse. For post-thyroidectomy, it's semifowlers, prevent neck flexion or hyperextension, and trach should be at the bedside. During hypokalemia, we see muscle weakness, dysrhythmias, and increase potassium using raisins, bananas, apricots, oranges, beans, potatoes, carrots, and celery. Lastly, for hypokalemia, remember it as muscle weakness, urine oliguria or anuria, respiratory depression, there is decreased cardiac contractility, ECG changes, and reflexes. I hope you found this video helpful. Please stay tuned for more videos that will be coming out in the future. Thank you for watching.